We have more breaking news. This related to the coronavirus in Virginia. State health officials say one patient with COVID-19 has died, the first in the Commonwealth.
Virginia reported its first death from COVID-19 on March 14th.
Priority 1 response.
The same day, a resident at the Canterbury Rehabilitation and Healthcare Center in Henrico's West End developed symptoms.
So we immediately isolated that patient, and we partnered with the Department of Health to test. That was our first patient tested here in the facility.
4 days later, Dr. Jim Wright, the medical director at Canterbury, says that resident tested positive for the coronavirus.
We had been ready for this and had been meeting regularly to prepare ourselves. So rather than shock or panic, we really began to focus on our protocols that we had set in place.
The resident had 2 roommates who were immediately sequestered and tested.
Of course, we were concerned that this patient was on a hallway, like most of our hallways, where nurses, aides, and patients themselves will travel from room to room. And so the potential for spread was very high.
But Wright says he could not test most of his aides and patients for the virus due to extremely limited supplies. In fact, the testing he had access to at the time had a turnaround time of 11 days. What do you do when you're waiting for 11 days? Are these people isolated, and is PPE in use every time with them?
They're isolated, and for the most part, we were correct about the people we had under suspicion. That was a huge area, a gray area, where you simply can't fight what you can't see. And we didn't know the size of the problem at the beginning for those reasons.
It wasn't until March 23rd, a full 9 days after the first resident started exhibiting symptoms, that Canterbury had access to widespread testing with a quick turnaround time through a private lab certified by the state. 1 day later, the first 2 residents at Canterbury died.
Welcome everyone, my name is Danny Avula. I'm the Public Health Director for Henrico and Richmond. And we're here with you today, myself and Dr. Wright, the Medical Director at Canterbury Rehab, because it has been an extremely difficult week.
Wright tells CBS 6 that staffing issues also made his facility vulnerable, saying that nursing homes like Canterbury, who receive most of their money from the federal government through Medicaid, are chronically understaffed to begin with. And the outbreak exacerbated the issue.
There was a lot of fear, and as a result, we had difficulty in attracting our regular staff to the building, and then also engaging staff from agencies.
Things got so bad that Wright's own wife, a physician for Bon Secours, actually took time off from her job to help at Canterbury.
We were all doing things that we normally would not be responsible for. So for example, I was changing patients, cleaning beds.
All the while, the virus spread through the facility. To date, 128 residents have tested positive for COVID-19, and so have 35 staff members. Often, they showed no symptoms.
A publicly funded nursing home is a virus's dream. It's the best place for a virus to be. People are close together. Their immune systems are compromised. It is just, if you want a tinderbox for that match.
So far, COVID-19 has claimed the lives of 45 Canterbury residents. Many of them died in Dr. Wright's care.
It's been horrible, and these are not just patients. These are friends and family members, and we know that they're people's mothers and fathers and spouses, and we die a little bit every time one of our residents dies.
Recently, Henrico County Manager John Vitolkis expressed frustration with Canterbury officials, saying that they rejected the county's offer to help with testing early on. Wright says that's not the case.
I can't think of any case where he has actually offered help that we decline.
A lot of our viewers are wondering, was this random luck that this happened at Canterbury, or was it something about the protocol and how they do things there that led to this dramatic spread?
I think this is our opportunity as a society to not look at a nursing home and point fingers about what they could have done better. I think it's an opportunity to look at ourselves and what can we as a society do better to give our elders a meaningful life.
Coming up on Thursday at 11, I talked one-on-one with the head of the Richmond and Henrico Health Departments, Dr. Danny Avula. He explains why he does not blame Canterbury for what happened there. He also talks about why he thinks we will be social distancing until at least June. Working for you, I'm Melissa Hippolyte for CBS 6.